So, hello everybody, this is Andy Perwin with ACS Business Insurance Services with your bi-weekly healthcare reform update. Grace and I will talk to you a little bit about some of the changes happening recently with the Obamacare law and the healthcare reform issues that we're facing today. Grace is going to go over some of the information and we'll go from there. We'll try to make it short and sweet.
Always sweet. So I'm briefly going to talk a little bit about the shop exchange and what the shop exchange means to a small group employer. Things are changing and we're getting more definitive answers from Health and Human Services as to what each particular mandate is going to allow. So this first one is the shop exchange, which is basically, it's another avenue for small businesses to go to shop for their employer benefits. Now this means that it's for groups under 50, I don't mean age-wise, I mean under 50 employees. And it does not apply to sole proprietors or grandfathered plans. So if you are going to go to the shop exchange, there are a couple of things that are unique about it, that under 50 can shop this exchange, and it's really just another avenue, another marketplace for Andy and I to shop for benefits for you and your small group. And there are also provisions that if you are a smaller business with less than 25 employees, you could qualify for the small business tax credit in the exchange only beginning in 2014. So there are a lot of complexities with this law, and there's a lot of complexities for all the things that I had just told you about. So if you have any questions, feel free to call us. We are studying this daily to make sure we're keeping you up to date and make sure that you have an understanding of what you as the employer can offer to your employees beginning in 2014.
I'm going to throw an update in here as well in regards to some of the reports we're receiving from some of our trade magazines. One of the interesting things I found was that Reuters reported that Kathy Celebus, I hope I'm saying that name correctly, she's in charge of Health and Human Services. So she's the one who obtains the law and then puts it into a format that's usable for what our requirements would be under the healthcare reform bill. She admitted this last week that the cost of the insurance is going to go up as a result of the new federal laws. And that was reported by Reuters. And she admitted also that the complexities implementing the new law were extremely difficult to put together, and much harder than she thought it was going to be initially. And this law came out back in 2010. So they're struggling with trying to figure out how to implement the law. The reason I bring that up is real simple. The law is fluid, it's changing, so we are just doing our best to keep up with it. There's a lot of changes that come out almost daily in regards to this law. So keep that in mind when you're making your plans for the future. Realize that there may be some changes in the law. Again, thank you for watching the video. This is Andy Perwin and Grace Butler with ACS Business Insurance Services. We can be reached at acsinsurance.com or at 775-425-3233. Thank you.
Thank you.
Bye.